with all of this, it almost makes sense that there's some sort of anxiety. And this is so common, and fear is driving all of what we do. You think about it, if we don't figure out what's going on, that can harm a patient if you don't do the proper procedure. Or maybe if you do a procedure that could harm a patient. Everything that we're doing, we're constantly weighing risks and benefits so that we understand what's the best outcome for the patient, but that doesn't always work out the way that you want it to. The other thing is that this is such a high intensity profession, and we're always in fear of making mistakes. And that can result in bad patient outcomes, but it can also result in lots of other things as well. You can be blamed for a poor outcome for a patient, even though you've done all the right things. And perhaps that outcome was going to happen whether you intervened or not. These are the things that we are worried about as healthcare workers. You could do your best and you could do extraordinary heroic measures, and still, whatever the process is going on, still may not make a difference. And that's really hard because you really want good outcomes for the patients, but we don't always get to have that. I think one of the biggest things that we deal with from every moment of our career is being sued. And everything that happens, the entire format of medicine has changed over the last several decades, and it has a lot to do with being sued. And everything that you do is under a microscope. And again, like I said, if a patient has a poor outcome, it may be nothing related to you, but you may have to go through a 2-year enduring assassination of who you are as a person to prove that you did what was best for the patient. But patients are angry, patients' families are angry, and it's a really difficult place to be. And we end up changing how we practice medicine so that we can defend ourselves in court and say, well, I knew this wasn't the problem, but I had to do XYZ to prove that that wasn't the problem. So in case I get sued, and the documentation that goes with all of that. So, I mean, just imagine every moment of every day of your job that you're sitting there with someone sitting on your shoulder, scrutinizing, saying, I'm going to take you to court. I'm going to take you to court and I'm going to take all your money. I'm going to close your practice and I'm going to assassinate you publicly and all over the internet as well. And that's what we healthcare workers are dealing with. The other thing, again, online, it's very interesting. When I first started practice, this wasn't ever an issue, but obviously this has become quite common, and online reviews. And so pretty much most businesses have online reviews. The problem in healthcare is that we have something called HIPAA. And so this is to protect your privacy. And what ultimately happens in this scenario in healthcare is that the patients have carte blanche to tell whoever and whatever they want about their medical care. And they can be online, but we cannot. We cannot really discuss it at all. And so we're we're basically chained to having people harass us online, and we can't even respond. And then patients are coming to sites to look at us. If I'm at a hotel and someone writes a bad review, I still have the option of saying, yes, that's true, but you were crazy and you trashed my hotel and you broke these things. And so there's two sides to that, a rebuttal. But in medicine, we just have people who they just know that there's nothing we can do about it. All we can do is sit there and keep taking it on the chin. But we keep taking it on the chin over and over again, and no one's coming to help us. And legally, there's nothing that we can really do about it in the state of the law and the legal system right now. So, finally, one of the other things that we fear, and you may have seen this in the other episodes and talking about our kids and our spouses and our families. And, we wonder what they think about us when we're at work and we're doing all these things. And maybe we don't come home so nice. And we've dealt with all these other issues and all these fears and all these even potential assaults. Now we have to come home and then we have to be the mother, the father, the wife, husband, and we just have to show up and be present for our kids. And so we're always thinking about what is our family thinking about with us. So anxiety is huge in our daily world for all people.